Hi everyone. Today we're going through an approach to breathing difficulties to help with your Apex History Plus. So, in terms of initial assessment, you want to be standing back and observing the child, and then for primary assessment, doing doctor's ABCD. And while you're doing that, asking yourself if this is life-threatening or not, and that will help with the management plan, seeing if they need an urgent referral, or this can wait. And while you're doing the doctor's ABCD, in terms of resuscitation, the most important thing to maintain is their airway, and that's because the most common cause of an arrest in a child is hypoxia compared to a cardiac cause in adults. And you also want to beware the normal, OBS chart. So children are very good at compensating. So just because their OBS are normal doesn't mean that they're fine. And then in terms of the assessment, you want to be doing a standard PEDS history plus looking more into the respiratory symptoms. So looking at asking them if they have a cough, the nature of it, is it wet or dry, any triggers, if there's a wheeze, and then any shortness of breath, and then asking them if how it's impacting their life. And a lot of the times in a PEDS history, you'll most likely be talking to the parents. And other associated signs and symptoms include vomiting, fever, a recent viral illness, poor feeding, and asking them also about feeding inputs and any urine output changes. And also immunizations are very important to ask about. In terms of physical examination, I think the most important is actually to observe the patient. So I can't stress that enough, and minimal handling of the patient and the child because you don't want to agitate them anymore. They're obviously very uncomfortable with, having trouble breathing. And so if you're, constantly trying to examine them, touching them, you might actually make them cry even more. And that would obviously make the breathing worse. Signs of respiratory distress include nasal flaring, head bobbing, tracheal tug, use of accessory muscles, stridor, pallor, cap refill, drowsiness, increased rest rate. And then with investigations, it's often not needed. You can often, diagnose it clinically, and we try to reduce the amount of investigations we do for the same reason for minimal handling because it might cause more distress to the child. So in terms of what it could be, when you're in the Apex History Plus, you can be thinking about whether it's an upper airway or a lower airway pathology. So I've just written down some of the common conditions in both camps. So for croup, you'd be asking for if there's any inspiratory stridor, harsh barking, sea-like cough, and then checking their age. 6 months to 5-year-olds are mostly the presentations for croup. Um, yeah, and so in terms of your systems review, you can have a read over this slide, and you can see what the main things are you'd be looking out for each of these conditions. And then just in general, any general Apex History Plus tips for a PEDS station for respiratory. So again, the cough, looking more into the character, any triggers, is it related to feeding times or time of day? Is it productive or non-productive? Any signs of infection? Noisy breathing or abnormal cry? And then asking some of these other questions as well about the nature of the breathing and other signs and symptoms. So chest pain, increased work of breathing, upper respiratory tract symptoms, and that can help with delineating between an upper or lower respiratory tract condition and hyperventilation. And then in general, other things include birth history, past medical history, medications they're on, any immunizations, if they're up to date, and then environmental factors as well. So asking if they live in a smoking household, is there, constant air conditioning, any mold in the house that might be contributing to their breathing difficulties, and then family history. A good acronym you can think of is BINDS. So this is a good framework for pretty much any pediatric history. So birth history, immunization history, nutrition, what's their diet like, especially in newborn babies. So asking them how much milk they're having. Um, and that would also include any growth parameters. And then their developmental milestones and any social history. And also, I think ultimately it's, bring it back to, is the parent concerned or not? The parent will know their child the best. And so if they're concerned, then you should be concerned. Yeah, so this is a very general overview, and that should hopefully help with your Apex History Plus and how to tackle it. Any other general tips I have include using the reading time really well. So just reading the task and actually making sure that you do what the task wants you to do. Um, and in your reading time also, um, just have a list of differentials written down so that you can always fall back on it and ask questions to rule in or out those differentials. And that will really help you in the room. Thanks.